Fire.
Fire. Fire. Man.
So, good morning, everyone. Thank you for joining us today for our Teaching Meets Wellness conversation. So, this event is an open conversation with Dr. Monique Swift, who will be facilitating our conversation today on the topics of trauma-informed approach and its intersection with race and race relations. This is the second event in our Teaching Meets Wellness program for the year. And so this whole idea of teaching meets wellness this initiative came about because we as a group, had this idea and we had these concerns about topics that were really pertinent for today's world. And so we wanted to share our thoughts, share ideas, and also bring really thoughtful and also really experienced people to discuss these topics with you, people with expertise in the area. And so we're very happy to have Dr. Monique Swift here with us. And also, we'd like to invite you back to our future events, right? Where we're going to have our Teaching Meets Wellness conference in the spring. So we'd like to invite you back to that event as well. So we hope you have, and we know these topics may not be the easiest of topics to broach, but there's still topics that need to be discussed as well. So thank you for joining us today. And I'll just, JC Williams will now take the lead.
Good morning, everyone. So glad that you're all here with us. It is my absolute honor to introduce you to Dr. Monique Swift. Her accolades, I could go on and on and on and on and on, but how I know Monique is she is the current president of the New Jersey chapter of the Association of Black Psychologists. Recently, she also became within our beloved organization, the Eastern Regional Representative. So her expertise is phenomenal. But what I like the most about Monique is that she walks her talk. She's involved with the community, all communities that are dealing with these issues of trauma. It's one of her specialties. And now she's been doing it before it became in vogue, the intersection with trauma. A lot of us have been doing trauma work, but nobody wanted to talk about it, like myself. But so the other thing, she is easy to communicate with. So if you have questions, please be sure to ask them. Please, Stacy and I will be monitoring the chat so you can ask them because she wants to pretty much address issues real time. And then the thing that I want to remind everybody, as Stacy had alluded to, this is tough information. So please plan some self-care for yourself after this is over, because who knows what this may bring up for you. So think of what can I do to take care of myself after you've been exposed to this information. So without any further ado, I'm going to turn it over to Dr. Monique Swift. Thank you, Dr. Swift, for doing this.
Yeah, oh my God. And thank you so much, JC, for inviting me here, and Stacy as well for opening space for me to be here with you all today. And I tend to do a lot of talks, but I have to say that is the best intro I've ever had. Thank you so much. And I mean, your words were meant a lot to me. So thank you. I do very much appreciate that.
You deserve them.
Oh, I appreciate it. And so I'm really happy to be here with you all. Trauma is my thing. I think it's so important. We should all be kind of raising our awareness to trauma. And most particularly, I talk a lot about trauma and race. I'm interlacing that in today, but can and am willing to, I guess, go further with that if you want to go further with it. So we don't have to stay within the confines of what I've put together for us, but I did put together kind of a very basic presentation. I wasn't sure where people were. And so I'm providing kind of basic baseline information on trauma and what it means to be trauma informed, but would be delighted to kind of take that conversation in different directions, depending upon where and how you need to understand it. So I hope that's clear. And you might see me in here twice, by the way, because I like to be able to, when have the screen up, I won't be able to see anything. I won't be able to see the chat or anything. So I'm in here twice so I can kind of see some. And I know people don't have their cameras on. I see Marcella's beautiful face and Diana's beautiful face, and hopefully other people will be willing to come on. But I do like to kind of see and talk to people and have you engage as we're going through the presentation. Don't feel compelled, but that's why I'm in here twice, just to explain that to everybody. It might look a little weird. So that said, if there are any questions, anything for me before I start? Anything that people are like, you know what, as you're going through this, if you don't touch anything else, I want this. I want to hear you talk about this. Anything in particular that you guys really came in for that I should be aware of? Okay.
Well, I'm really here. I forget where the other one of these sessions that I joined before, and I'm interested in how I can, because what I'm noticing a lot is that the students are asking more and more and more of me, and I am depleted more and more and more. Like just today has been all day with emails. And just to make you guys laugh, I'm here in Puerto Rico on a conference thing that I had to do. And you guys know, like when somebody pays for you to do these things, it's like, oh, this is so great. And I'm supposed to be feeling so great. I'm in Puerto Rico. I'm looking at my window, but I gotta be on the computer because I still have to meet with 3 more students at 12 o'clock because they have all of this, I guess, trauma that they're dealing with that automatically now becomes my problem because I'm devoted to their success.
Thank you for making mention of that. And I didn't have that in there, but I'm glad you said that, because I mean, you're kind of speaking about vicarious trauma, vicariously absorbed stress. And that's an important piece to realize for people who do clinical work, people who do the work like what you do. You are absorbing a lot of people's stuff. So let's keep that, if we can, in the backdrop. And I'm hoping I can remember to kind of circle back to that and punch a few points after we go over some basic content, and really hopefully drive that home in a way that maybe is helpful for you. Thank you for bringing that up. Anything else that anybody wants to really hone in on? All right. Okay, so where am I here? Just want to do that one. Can people, you can see the screen? I just want to get rid of my boxes if I can. Get stuff out of the way. Alrighty. Okay, and by the way, as we're going through some of the content, if you have questions, if you just want to share a story, can relate to something that's being said, or have a comment, by all means, please feel free to chime in. You do not have to wait till after everything is, said and done and then, chime in then. Please stop me as we go along. I don't have any problem with people keeping themselves off of mute and just speaking. So that's fine with me too. If it's maybe long and involved, you don't want to put it in the chat, or if it's short and you just want to say it, please, all of the above are welcome. Feel free. All right. So basically, I'm sorry, I didn't put this in the, there we go. All right, so this is, again, I'm going to go over some, trauma basics and trauma informed basics, and hopefully help you to have a, general understanding of what trauma is, and then also what it means to be trauma informed. And hopefully you'll connect that with and be able to relate that to how it shows up in the school setting, how it impacts you on a daily basis, and also how it impacts the students that you work with on a daily basis as well. So I want to kick off with what is trauma, right? So basically, what is trauma? When I ask this question, and I do this a lot, these are the types of responses that I tend to get. When I ask the audience of people, well, what is trauma? What comes up for you? What events come up for you? And they'll, the death and natural disaster, war, abuses, these types of things tend to be what, comes up in people's minds when they think about trauma. Now, naturally, these tend to be experiences that create trauma. So this is not incorrect, it is correct. But these are what we have come to call big T traumas, right? These are the trauma experiences that they're loud, these are the ones that get the headlines. These are the ones that are very, they're blatant, they're obvious. We see them, we see the impact of them, right? And so, and this is fine, but I just want to kind of capture and understand these tend to be the big T traumas that people think about automatically. But the thing is that events that tend to cause trauma are not always big. They're not always visible, right? And we can't always see the direct impact of those. And those are the things I kind of want to emphasize here. Can anybody think of any examples of experience that could potentially be traumatic, but they're not really big and loud? Can anybody think of anything? You can feel free to put it in the chat, or you can just say it outright if you would.
Marcella is saying the pandemic.
Okay, the pandemic, absolutely. So the pandemic, I think I would put pandemic as one of those big T traumas, right? But there's a lot of little T's in that one, right? It's big, it's visible. That's all we've been hearing about. That's all we've been talking about. Definitely got the headlines, right? Big impact. But there's some little T's, right? There's some things that are, not as visible, not as, like, so for example, a lot of women, I saw some statistics around how a lot of women at some point during COVID had to make a choice between, am I going to go to work, or am I going to stay home with my child who can't go to school because I don't have daycare, and help my child learn, right? Being put in that scenario, people often didn't think about some of those types of things that happen, and also didn't recognize them as being traumatic. I think there were some other things that were put in the chat here, but that's visible. Oh, somebody said, yeah. Son's constantly driving without a seatbelt. It can be just, yeah, right? I'm worried, like, I know that boy's out there and doesn't have on his seatbelt, and my God, I hope nothing happens, right? Balancing a private life with the demand of our career. Yep, you guys are on it. Having my camera off as I was constructing, on my, wait a minute, I have my camera, oh, okay, so I'm just noting that. All right.
Hello, Nancy, good to have you join us.
Yeah.
I also think about things like, bad relationships, right? Sometimes, domestic violence, people don't think about those things as causing trauma.
Yeah, yeah. So domestic violence,
homelessness.
Yeah, go ahead, Stacey.
I was also thinking about, like, as a parent, I think about parenting could be causing, how we parent our children based on how we've been parented in circumstances, that kind of generational kinds of trauma as well. So
yeah,
maybe things that people don't see as often, because as you were saying, they think about the big things, right? War, big, like 9/11, people think about those really big events. So, but people don't often think about Tony has like illness and injury. I think that really is something.
Right. And so, yeah, illness, injury, sometimes, we're stricken with chronic issues, right? That may be degenerative and going to get worse over time. So you're thinking about like the loss of ability. You're thinking about the loss of quality of life. Like that stuff is traumatic, right? You mentioned domestic violence, which in many cases tends to get the headlines, but what doesn't get the headlines is that other element of DV that is like coercive control, for example. You know, you don't see the bruises, you don't see the injury, but there's been some kind of, you know, stress and psychological harm because that person is controlling someone else and so forth. So you guys are really on it. Also being able to be close to your aging parents, lots of guilt. Oh, not being able to be close to your aging parents. Yes, yes, right? So all of these things, I've kind of listed here some other things that are less commonly recognized as traumatic events. These are things that people, you know, that tend to escape our awareness, and we call these like the little T's. So the other ones are the big T's, right? And these are the little T traumas. These are the traumas that don't really make the headlines, but they're traumatic nonetheless, right? So you talk about just growing up as a young person in a chaotic living environment can be very, very traumatic, right? Not knowing, not having structure in your home, not knowing, you know, who's going to be coming and going, lots of people in and out the house, not having maybe a certain place for things. Maybe you just kind of lay your head wherever, right? Because you don't have a specific place. So that chaotic living environment, poor boundaries might also be a part of that. And create a traumatic experience. Pervasive uncertainty, unpredictability, vicarious trauma that Diana talked about a little bit earlier, right? Vicarious. We don't experience directly ourselves, but we're impacted because we're constantly hearing about the experiences of other people that tend to be traumatic. And we don't realize that we're being impacted. If I put a side by side up for you of the impact of trauma, direct trauma, and the impact of vicarious trauma, you will see the same effects. It's no different. So we kind of think that, oh, okay, I didn't experience it myself, so it's probably not as bad, but you are absorbing the traumas of other people that can be just as impactful. Living in a community where there's a lot of violence, if there's need, want, food insecurity, residential insecurity, losses, I think somebody mentioned, caring for others. So microaggressions, structural racism, right? Those are things that tend to be that people don't see. Like you see the racial insults that are blatant, that are open, somebody's attacked, there's a police shooting, and we kind of get the sense, yeah, you know, we know that same thing wouldn't have happened if that person was white, right? But what about the structural stuff that we don't really see? What about the limitations that people experiences, or the invisible barriers that people bump up against, right? Because they are part of a community, a non-white community in this country that so you have these kind of invisible boundaries that this is as far as you're going to go, right? So that marginalization, it might be because of race, it might be because of gender, or I'm not speaking English, or I speak it with an accent, right? And so people kind of categorize you and marginalize you because of that. Documented status, like so all these things are, and of course this is not an exclusive list, you shared some others that are not even included here, but this just wanting to elevate that there are experiences out there that really escape our awareness that can be extraordinarily traumatizing. And the thing that I think is most insidious, I think even more insidious than the big T traumas about these traumas, is that they tend to be less traceable to trauma. And what do I mean by that? When we see somebody who's impoverished, for example, we see somebody who you know, is marginalized, right? Or has an undocumented status, or we see the effect of somebody living in a community where there's a lot of violence and victimization going on. We see what they end up as, or how it impacts them. And we begin to kind of look at them as somehow they're inept, right? That they are somehow deficient because you're in your situation, you're impoverished because you just neglected to pull yourself up by your bootstraps, right? You didn't go to school like you should have. You should have gone on to college. You should have stopped at high school. You should have. You follow what I'm saying? And so what we didn't see was that in school that they were perhaps, got stuck in that school to prison pipeline. We didn't see that because of the intergenerational historical trauma that they've experienced in life, that their parents were extraordinarily marginalized and disadvantaged such that they could not give the child a leg up in the way that most parents do and would want to give their child a leg up. And so in many cases, that disadvantage gets passed on intergenerationally. So I hope we're seeing that. We don't see or we don't connect these types of little t traumas to the fact that they are trauma, and tend to look at the person themselves as being the reason why they are experiencing the condition that they're experiencing. And so another point that I want to kind of pull out here and kind of moving us toward another thing is that when it comes to trauma and us being able to identify or recognize trauma, often we tend to lean on what I call the what of trauma. Often when I ask about trauma or people think about trauma, we think about conditions or circumstances, events that are traumatic, right? And I like to emphasize and try to dissuade people from thinking about trauma from the what perspective, from thinking about trauma from the point of the event. When somebody experiences this event, then they tend to be traumatized. I do that because I try to kind of de-emphasize the what and then emphasize more of the when. This is an important piece that I want us to really get. Why do I emphasize the when? Trauma is not just about the what, and that when people experience this, the what, that they experience trauma, but rather that trauma is more about the when, right? That trauma is when one or more stressful experiences have an enduring adverse effect on a group or an individual that overwhelms the ability to adapt, cope, and function in a healthy manner, right? Understanding that trauma happens when, this is my definition, because I find that many definitions out there really kind of hone people more in on the what, and people get stuck there. But when you understand that trauma happens whenever I'm overwhelmed, whenever being overwhelmed causes me to not be able to function or cope in a way that I ordinarily would, then that's when it's said that I have experienced trauma, right? So then that pulls us away from this thinking about trauma from a big T perspective, and really helps us to broaden our understanding of trauma, such that we recognize that, oh, okay, trauma is not just about a big experience or this out of ordinary experience. Trauma happens all the time. It's happening to all of us at any given point. It's happening in major ways, but it's also happening in very small ways that are not noticeable, but impactful nonetheless. And so in understanding it this way, we understand that all people who've been overwhelmed in some kind of way and experienced some sort of lasting impact have been traumatized, right? And it's important to understand it in this way too, because two people can go through something. You can go through some experience and just be fine on the outside of that and think that that's not a traumatic experience, because I've gone through that. I've seen other people go through it and they're fine, but then somebody else went through it and they weren't fine for whatever reason. One of the things that we see with trauma is that two people can experience the same experience, and two people can have different impacts. One person be impacted, the other person can be perfectly fine. right? And so this is why it's kind of more important to see about the when. If somebody has a long-term adverse impact, there's trauma. It doesn't really matter what the what is. It doesn't matter what they went through. The important thing is recognizing that there was an impact. I hope this makes sense to folks. Does this make sense? Yeah. Okay, any questions about this? Like what trauma is and understanding trauma? Okay, I'm going to assume we're all on the same page. I want to shift a little bit. I always try to squeeze in some pieces about the physiology of trauma, and I'm going to try to do this very quickly. And I think it's important to understand trauma because, you know, it really doesn't matter if it's a big T trauma or a little T trauma, whatever it is, trauma is biologically based, right?
Monique, Tony has his hand up.
Oh, I'm sorry. Oh, thank you for calling that to my attention. Go right ahead, Tony.
I just wanted to offer a comment, and this may come across as rather indelicate, but I really appreciate the last point that you make. And it reminds me of a story. I happen to have an obstetrician in the house, and you know, when she's seeing patients, when she's seeing moms to be come into the office, I mean, a question that never comes up is how? How did this happen? Why? Because frankly, it's not really relevant to the nature of the conversations they're going to be having moving forward. And I think we often get trapped in that cycle of sort of looking back to try to understand what led to this. And it's not really relevant in many respects for how we take care of ourselves moving forward. And so the more we can look at the present, and the more we can look forward, I think the better off we're largely going to be. If I want to make sure I'm understanding your point, and it's that sort of the mindset and the framework that we sort of want to take with dealing with trauma like this. There's certainly value in looking back, but more about looking where we are and understanding sort of how to move forward seems to be the larger point that I'm taking from this. And I hope that's a fair sort of summary of what you shared. Yeah,
it's fair. I want to pull that apart a little bit if I can. So in embracing the spirit of what you're saying, what I understand is that you're saying when people can kind of focus on creating that vision, when people can focus on pulling themselves forward, it's better for them. I think there's some merit to being able to say that, but I want to look at this from another way as well. And this is most particularly important when we're going to shift into understanding a trauma-informed perspective. When I'm talking about understanding trauma, I'm also emphasizing that you as a professional, this person as a clinical professional, a medical professional, myself as a clinician, right? That we, in our interaction with other people, it is important that we think more about the context behind what we're seeing so that we can have a better understanding of how to respond. Now, if I approach my clients from the perspective of, yeah, that happened, but let's focus on right now and moving forward, I will more than likely be doing more harm than good by invalidating the experiences that they're having and just trying to push them forward without reconnecting them with what they lost that the trauma took away from them. That's important to realize, right? And so if I'm trying to be an agent of healing in the work that I do, or I'm trying to be in the work that you do, you're educators, right? You do important work. And it requires really kind of the whole person. You're working with the whole person. I think we don't always think about educating like that, but you really are. And there are impediments to a person being able to I guess absorb what it is you're saying. Trauma is one of those impediments. And so in doing what you're doing, you're in a position where you have to kind of take people from where they are into another space of understanding. And there's this barrier there. Trauma inhibits that. And we're going to see a little bit more about how and why trauma inhibits that. And if you're successful in doing what you're doing, we have to understand that background. We have to understand that context. We have to understand what we're up against. And so I want to emphasize that when we're talking about understanding the context behind things, I'm more talking about you as a person being able to see behind the person that you're interacting with, and not necessarily just from you working within yourself as an individual. I hope that made some sense as a point of distinction. Did that, Tony, make some sense?
Yeah, it does for me entirely. So yeah, I think the word context is really important here. You want to know sort of who you're dealing with, and to get an understanding of what the person lost as a result of sort of the traumatic experience. And yeah, so absolutely, I think we're very much in a sort of, I understand the point that you're making.
And so there's an and both here. So I can embrace the point that you're making, and yet at the same time, there's a certain degree of empathy, right, that is elicited when you're able to look at a person in the context of their reality. So, so thank you for that question. Really important point. And so looking at, again, the physiology of trauma, that, again, no matter what it is, it all has basically the same biological base, and that biological base is in that fight or flight reaction, that fight or flight response, right? This is the underpinning of all trauma, no matter what it is, or of all stress, not just trauma, but stress, because I look at it on a continuum. There's stress, and then there's traumatic stress, right? And so this is kind of the physiology of stress, right? I want to go into a little bit here. These are some of the systems that are invoked when people experience stress. Now, I don't know how you learned about it in school. They talk about the bear in the woods. I don't know, some of you might even teach it, right? When you encounter the bear in the woods, you go into fight or flight, and this is some of the things that happen. This is not an exclusive list. There's a lot more that happens physiologically than what we see here, but this is just some of the systems that are involved when we're looking at a stressful situation. You see that bear in the woods, and all of these systems kind of get invoked. Some systems ramp up, go into overdrive, and some systems shut down. And that happens so that your body is optimized in being able to fight or flee from the threat, right? And so the skeletal muscular system is one that ramps up. Obviously, we want to be able to fight really hard, or we want to be able to run really fast. So our body ramps up our skeletal muscular ability, right? Immune system, that shuts down. When we're in a moment of threat, we don't want to waste any resources on our immune function. So that just gets shut down. Digestive system, that shuts down as well. As many of you know, right? Eating and digesting your food takes a lot of energy. When we're in that moment of threat, we don't want our body to put all that energy into digesting. We leave that alone. We want to rewire those resources, or redirect rather those resources, into the skeletal muscular system and other things. Cardiovascular system as well. That ramps up. We want that heart to pump. We want to get the oxygen out into the bloodstream, so we can get into the limbs, so we can just function, right? We want to be able to respond. We want to be able to respond fast. We want our lungs, the capacity for our respiration to increase. Our breathing tends to get very, very shallow and very, very rapid, so we can get more oxygen into our lungs, and then of course into our bloodstream. In the nervous system, our cortex is, two things are happening. The cortex is shutting down, right? So this is why maybe if you have, anyone has ever encountered somebody in the moment of like something really serious that happens, maybe they get really pale and you're trying to talk to them and they have this kind of vacant look on their face, that cortex is shut down, right? The blood that typically gets circulated to the cortex is being redirected to the limbs so you can fight or flee, right? And so that's getting shut down. And in the process as well, the sympathetic nervous system is ramping up. And that's kind of what's responsible for all of what we're seeing here. That sympathetic nervous system is what kind of triggers all of this. Now, this I want to emphasize is a good thing, right? if we are encountering that bear in the woods, we're experiencing threat, we want all of this to happen, right? And so this is a good thing. And we call this eustress. We call this good stress. We call it eustress. We want our bodies to do all of these things so that we can overcome whatever it is that's in our path. But you may notice it's so physiologically based, right? And this is a evolutionary survival ability that we have acquired against physical harm, physical threats. The thing is, in the society that we live in today, we are often triggered by lots of things, and they're not always physical, right? When we have to pay that bill and we can't pay that bill, maybe our lights are going to be cut off or are cut off. We don't know if we're going to be able to pay our rent. We have a deadline at work and it's a real serious deadline. Maybe your job will be on the line if you don't meet that deadline. We are today under so much psychological stress that we are triggered all the time. We're always triggered, right? And so when we're under an experience of chronically being triggered, or if we're under a condition of just being completely overwhelmed, you're standing at the bottom of that mountain and here comes the avalanche, right? When this happens, that eustress becomes distress, right? Now we're going into distress. So two things, it's completely overwhelming. I can't do anything about it. Now that becomes distress or traumatic stress. Or when I'm triggered chronically, I never really get a chance to turn it off. At this point, that's when something more deleterious begins to happen on a physiological level. And so what was once something that was very good, right? Something that supported our survival, now is beginning to threaten it. And so all of those things that were happening in our body before, where the skeletal muscular system ramped up to try to help us to fight or flee, when that's being triggered chronically, that becomes chronic muscle tension, right? Headaches, these types of things. The immune system shut down. We want that to happen in the moment, but do we want that to be the case all the time? Do we want our immune system shut off chronically? When that shuts off chronically, now we've become very vulnerable and susceptible to all kinds of illnesses and diseases because our immune function is being compromised. Digestive system shut down. Over time, irritable bowel syndrome, right? Diarrhea, nausea, ulcers, this type of thing. Cardiovascular system ramped up. That's a good thing in the moment, but over time, that ramp up becomes heart disease, heart attack, strokes, right? Our respiratory system was also ramped up. That would become a hyperventilation, or it could lead to panic attacks. And remember, there were two things that happened within the nervous system. If you remember the cortex, the cortex shut down. That's where our higher order thinking is, that part of the people that you work with that you're trying to like expand the most, right? Well, after a period of time, that becomes impaired neurodevelopment. What science has shown is that structures in the brain actually atrophy, most particularly the amygdala and the hippocampus, which is invoked when it comes to memory, right? And translating things into long-term memory. Those structures actually will atrophy in brains where there's a lot of chronic stress. And then the sympathetic nervous system also, remember that ramped up. When that's ramped up for a long period of time, it gets stuck on, right? And so what normally happens is I'll experience some sort of something that I'm walking down the hall and my child jumps out at the end of the hall and, oh my God, scares me. And then right after that, oh, it's okay. And I'm fine. My body takes me down. The parasympathetic function kicks in and takes me right back down to my baseline. Well, when you're constantly triggered on a chronic basis, that kind of gets stuck on, and you don't just automatically go back to baseline. You now have to do something in order to stimulate parasympathetic response. And so This is important to understand because we often just kind of think about trauma, and we think about stress as this kind of psychological phenomenon, but it's a very physiological phenomenon. Okay, I'm sorry, I was just trying to check the chat to see if I missed anything.
Marcella has her hand up.
Yeah, yes, hey.
Hi, thank you, Monique. Because I have a quick question. What's the relationship? I mean, how does stress also relate to lack of proper rest? So in other words, what's the difference of this kind of symptoms being related to deprivation of, enough rest versus stress, which I think it's something that academics experience a lot. Like, when we are working on some deadlines and we tend to push ourselves and, we diminish, right, the amount of sleeping time. And so sometime I think, I'm experiencing some of this, but more because I'm not properly resting as opposed to really being stressed chronically. So like how important is resting to feel also good and not stressed?
Yeah, thank you for that question. I wouldn't make a distinction. I would not make a distinction at all between the stress of, some of the other examples that I gave and the stress of not getting adequate sleep or the stress of not being adequately nourished, right? That's a stress as well. There's science that shows that people that go through famine, right? It actually changes their biology. It changes their epigenetic structure. And so I would definitely say when you're looking at interruptions of our circadian rhythm, you're also looking at a stress. You're looking at a form of stress that you're putting on your body, and any type of stress, when that happens over a period of time, you're talking about now something being destructive. You're talking about a degeneration, and you, as you so well just talked about, there's a deterioration of cognitive ability that happens when you don't get adequate sleep. It's not just that, but there's also physiology that gets interfered with. There's parts of our brains or certain times of our sleep cycle where our brains actually do the cleaning, right? Clean out some of what happens through the cogitation of our thinking process. And so when we deny our brains to do that, there's a buildup of those dead cells and things that, in our body, the lymphatic system will clean that out, right? But in our brains, there's a process that happens at night. When we don't allow that to do that, now we become sluggish in our thinking. We can't focus or concentrate, right? All of these things begin to happen, but all of that is a stress response. I wouldn't make any distinction from that or anything else, if that sounds fair to folks. Does that kind of speak to what you're, and so the point is, the bottom line, you have to get some sleep. It's so easy to cut into our sleep, right? I'm talking to myself. I have this, I don't know if folks can see this. This is what would you even call it? A light, it mimics sunlight. I mean, we have so many really poor health habits, and I know JC can do far more justice with this topic than I could possibly do. But that's something that I'm working on myself, kind of better regulating our sleep. We create daytime for ourselves 24 hours a day. We are no longer, we're wired to be connected to the cycle of the day, of the year, right? But go ahead, Diana.
Yeah, I just want to jump in because this is so important, especially for us women, premenopausal and menopausal. And I was literally very recently, and I'm a single mom, so I'm a VIP, right? Because I run the show around here and these people cannot live without me, right?
Yep.
So, I was literally waking up in the middle of the night in an anxiety attack. I was waking up like this and unable to go back to sleep. And that's when I really made the decision that, okay, that's it. Stop. Everything halts, everything stops, because that is extremely rare for me. okay, for that to happen. And I knew that I had reached my threshold when things like that were happening, because I'm resonating so much with everything that you're talking about here, with we just keep pushing, we just keep going, we just keep pushing. And that was the point that I reached, that I said, okay, now everything needs to be put aside. And what I'm experiencing now, though, yeah, no, I did. And I went back to meditation and yoga, and I see a therapist, and I said to her, you know, all this self-care causes more stress, because when I don't do the yoga and when I don't do the meditating, then I'm like, okay, you got to do it. You got to get in there. You got to take care of yourself. But what I think is unfortunate is what I had said before, is that it doesn't seem to me that supervisors, administrators, senior administrators are even taking into account any of this that all of us are going through. Because to be honest with you, I'm starting to take the role of the person in those meetings that's saying, okay, you know what, my colleague right now is not acting normal. And what kind of trauma is that colleague facing right now? Because when I was having those anxiety attacks in my sleep, I really apologized to my colleagues. And I said, I'm going to tell you guys right now, but I'm a zombie right now, because for the past 3 weeks, I have not slept normal. And so it was just happened in a meeting that I said, you know, to a colleague. I don't think she took it well, though, but I said, you know, what's going on with you? Why are you so short tempered? Why are you, you know, what's going on? Like, I reached out, and she's like, no, I'm fine. It's just blah, blah, blah. But I wish that our chair or somebody had said, okay, you know what? It seems like you're going through something right now, you know, maybe take a break or whatever, because it changes the whole dynamic of the entire meeting when one of us dips into that space, and maybe is not even aware that you're dipping into it, because guess what? Maybe she hasn't slept in 3 days because she's a new mom too.
Right, right. And so what you're saying, Diana, your awareness and how you're applying your awareness because of your own insight to what was happening for you, that's a trauma-informed approach. That is a trauma-informed approach. And that's what we're advocating across the board. And we'll kind of, I'm sorry, I'm looking at time, and so I'm going to kind of skip through some other things here. But I like what you're saying there, what you're bringing to the forefront, and hopefully we'll see how and why that is such a trauma-informed way of being as we continue to go. Any other thoughts or questions before I move forward?
I was just thinking. I'm sorry.
Go ahead. Go ahead, Stacey.
I was just thinking that, like Diana was saying, I guess the lack of acknowledgement, but also that maybe people don't know, they're not trauma informed, so to speak, right? But I think also when we're not trauma informed is the fact that people tend to rely on things like bootstrapping and this kind of sense, like when we don't recognize the when, and maybe we might recognize the what sometimes, but when we don't recognize the when, we tend to focus on this bootstrapping. Well, I went through this, you know, or, you know, this is normal. I think part of academia too is that people think you should go through a lot of what I don't know what people sometimes call dumping or whatever it is. But, you know, I went through all of this stuff. This is normal. I think we normalize it. I think we normalize the fact that it's supposed to be hard. It's supposed to be, you know, the stuff runs downhill kind of nonsense, right? And that you should just accept it. And I think, as you're saying, trauma is individual too, but also the systems also allow for trauma to get perpetuated over and over and over again, because, you know, the things go unrecognized or not validated in a workplace. And yes, it leads to things like sleepless nights, I think, right? Pressure and sleepless nights, hold on, and also the responsibilities of a lot of things. All right, but also thinking where we don't want to acknowledge that something is wrong, which this is not normal. Like, we know it's not normal, but we don't take the, you know, maybe we don't take the time to actually figure out how to do anything about it.
Right, which is why
I'd like to, I'm sorry, Monique. I'd like just to add one more thing to what Stacey just said, which resonated so much with what I think. And that is that, you know, part of, I think, the problem is that, especially in the United States, in between the culture of individualism and this obsession with productivity, you know, again, it's really hard to make a case for I need more time to myself. I need to take better care of myself and my family, because people tend to then perceive you as, weak, and especially for women, we are also dealing with this whole idea of, oh, women are more, vulnerable, they are more, sentimental, they are, more emotional, which I think it's actually a good thing. But so I think, part of it, it's like, how do we change, how do we break through this culture of extreme competitiveness and, that takes away, the human side of, of life, really. And I mean, it's like, it starts so early, the way that I see sometime, especially private schools, emphasizing, success, like how do we define success? And, even at Hostos, I'm doing right now a campaign about really creating more sensitivity around the issues of academic parents, especially under the pandemic, but beyond the pandemic, right? And I'm trying to make the case that this shouldn't be something that parents ask for, but this should be something that is just recognized, because again, family, as we know, is really the pillar of a functional society. And, when that crumbles, everything else crumbles, and so when we are thinking about social justice, for working class people and, and immigrants and minorities, it's like, how can you get that if you can support, working class parents in a way that's really meaningful? It's just like, you're asking them to sacrifice their family to make a living. And so to me, a lot of it is connected to, some of the struggle right now, in the United States about, what kind of society do we want to live in, and how do we make those changes so that they become systematic changes. They're not just about academia, or, it's just like something that everybody can benefit from. And I know that this is digressing to whole, but I think, all of this is connected to how do we promote social change that really matters and make it possible for us to take care of ourselves without having to constantly negotiate our space, our career, our families, and so forth.
Yeah, no, I think, I mean, it is connected. I agree. It is connected. And in the society, the trajectory that we're on, we're getting further and further away from kind of that humanistic, right, way of seeing ourselves and seeing our fellow human beings. And for me, this is why this whole trauma-informed, I'm going to call it movement, is so critically important. It's critically important because it rehumanizes us. It helps us to see our fellow human being in the context of the reality of their lives and the hardship, right, of their lives, and takes away the shame and the blame that often go along with the hardship and the trauma that many people experience. And so this is why I put so much into this. And it also, a trauma-informed approach, and as we talk about as I go along, I'm trying to look at time too, but a trauma-informed approach is not only for how you as professionals approach your students, or I approach my clients, or an MD approaches their patients, or whatever. It's also how we show up with and for one another. That's trauma-informed. And that's a piece, especially when I'm working with organizations or companies, they want to improve their bottom line often. They want well, you know, we want client satisfaction and therefore we want to be trauma informed. But yeah, that's important. Client satisfaction is important, but that's also intimately and intricately tied to employee satisfaction, to employee health and wellness, right? When you show up better, you will be better for the students that you teach. And that's part of a trauma-informed approach. We get that? Okay, so what you're saying is very important. And I want to make sure we leave time and space for content. Please do continue to talk. I'm going to actually, I want to move into the effects of trauma, but I'm going to zoom through some of this. I had a little activity that I'm not going to do. But suffice it to say, I want to kind of look at the effects of trauma, and that often when we think about the effects of trauma, we kind of like think about this box, right? Like the psychological impacts of trauma. We know about the nightmares and the flashbacks, right? We know about the, you know, maybe anger outbursts, the hypervigilance and all of these things. And all of these things are effects of trauma. There are many other effects beyond that. And I always like to emphasize this to people because people are less aware. There are also physical health impacts of trauma. Why? Based upon what you've already learned, why might there be physical health impacts? Adverse physical health impacts. And I think, Tony, you wanted to say something? Okay. Anyone? Why would that be the case?
I just think it feeds on itself. You know, we never acknowledge the trauma to begin with. So we try to do things sometimes to kind of mitigate it or get rid of it really quick. And then it leads us to doing worse things. So, and that compounds and leads us to having even more problems. Like when you said about the stress, Marcella, I think, you know, I think back about how acceptable it is for people who are stressed and not sleep to take a drink. How acceptable that is, right? We you know, and so alcohol, you take the alcohol, you take the pill, and then it becomes something to sleep. Maybe it helps one night, then it doesn't sleep. I mean, alcohol doesn't help sleep, by the way, but it makes it worse. I think that data shows that. But yeah, it's just that people go for something that they think is going to take it away. I think that's usually how people want to treat something like stress or trauma. They're like, all right, I'm gonna take this drink, or I'm like maybe for me, it might be eating something too much, you know, and so we want to take it away, and then it just leads to more problems. And being stressed all the time just opens you up to so much other things, which is like, you know, you're not sleeping, you're eating poorly, you know, then you're more susceptible to the colds, and you're more susceptible to the diabetes, and you're more susceptible to the hypertension because you're not eating the best thing. Like nobody who's stressed is going to eat kale, you know, they're going to eat, I don't know, Popeyes or something. I don't know. Maybe that's probably, I'm talking about myself too much, you know,
Ben and Jerry's ice cream.
Ben and Jerry's ice cream. You're going to eat all the things, right? And, you know, so you're going to eat those comfort things, right? Which aren't the best for you. Yeah. And you're constantly, it just compounds. Like it keeps going round and round.
Right. And that right there, right? Poor diet, eating a lot of comfort foods, that can impact your physical health. But another piece here is, remember, we just talked about the physiology, right? And how when we're chronically triggered, as many of us are, it actually takes a toll on our physical health. And so the chronic illness and the somatic complaints, muscle tension, this type of things should now make sense to us, understanding what's happening physiologically in the body when we're experiencing stress. One of the things, especially when I'm dealing with like grade school teachers, I often point out is the increased resting heart rate. And this is important. Often I will hear teachers, and I don't know if you're seeing this with your students, but we'll talk about a student they have, and, you know, I don't know what's wrong with them. They just went from 0 to 10. And you know, just a little thing happened and they were just at 10. And then, well, often I try to help people recognize that it may seem like they went from 0 to 10, but studies show that people who are chronically triggered or chronically stressed, right, chronically experiencing trauma, that their resting heart rate often can be almost as much as 10 beats per minute higher than a normal resting heart rate. And so you might be thinking that person is at 0, but that person is already on 6 or 7, right? And so it doesn't take much then to escalate that person when they're already there. Another kind of realm of impact is cognitive, right? It impacts our cognitive functioning, stress and trauma as well. Difficulty concentrating and learning. We talked about what happens at the neocortex gets shut down, right? Impaired, and as a result, you have impaired memory, impaired decision making. You don't think through things well, right? So you're not coping well, you're not making good decisions. We already talked about the hippocampus and the amygdala that actually shrinks over time, right? And then Stacy kind of got into some of the behavior stuff where that, right, because of the stress, you might reach for the alcohol or reach for the drug, right? Behaviorally, these things, you end up doing these things because it might, comfort you in the moment. So it creates certain behaviors when you're under a lot of trauma as well. So behaviors might be risky, poor impulse control, because you're not operating from the neocortex, you're operating from a very visceral, very basic, the animalistic, if you will, part of the brain. So you're just kind of operating off of instinct. You do what instinctually makes sense and not what you're thinking about making decisions, right? Problematic social interactions. It interferes with how you're interacting with other people, your relationships. It tends to make people withdraw. We're social human beings, but people tend to withdraw and isolate and so forth. And then, of course, increased risk for suicide. So why I kind of go through all this, I want people to understand it's more than just, flashbacks and hypervigilance. Much more. A lot of the things that you're seeing on a regular basis are connected to trauma, and you don't even realize it. You probably have students that when you look at this list of things, you say, oh yeah, that student, I'm seeing a lot. Can any of you bear witness to that? You're seeing some students in this kind of, yeah, right? And so it should hopefully draw us into wondering, what might be some trauma-related things connected to what I'm seeing with this student? That's the shift. That's the thinking that I'm hoping that we're getting into. And I'm not going to do this right now, but for the sake of time, I did want to do some brainstorming with you all, but we're not going to do this. But I want to spend the balance of the time really looking at our trauma-informed approaches, which is where we want to go, right? So this trauma-informed approach, there's some basic principles. There are 4 basic principles of being trauma-informed that I want to share. And so the first principle is the fact that trauma is pervasive, right? And I don't know if some of you have any of you heard of the ACE study? We've heard of the ACE study. Some of you have, maybe some have. So ACE study is a study that was done in the 90s. It's a landmark study that really, honestly, I think is the reason why we're sitting here right now, the reason why I've been so busy lately, because it really put trauma center stage in our awareness and brought it to our attention. So this was a study that was done with Kaiser Permanente, CDC. And essentially what this study showed, just if I want to cut to the chase, is that over 45% of people in the US have said to have experienced one or more ACE. I'm sorry, ACE stands for Adverse Community Experience. I'm sorry. Adverse childhood experience. There's also ACE, adverse community experience, that I teach on, which is another level of things. I apologize. Adverse childhood experience. So that's what the ACE stands for. And so it shows that over 45% of people have experienced at least one adverse childhood experience. And that of those people, a little over 18% have experienced 2 or more. Right, and 33% is said to have, at under the age of 5, are said to have experienced 1 ACE. And so this is important because in addition to just kind of understanding that trauma is pervasive, right, that there's this hardship, this adversity is happening to so many people, this study also showed us that there's a dose-response relationship between hardship, between adversity, and long-term psychological, and physical health. So in other words, the more adversity or trauma a person experiences, the more likely that their long-term physical and psychological health will be compromised, right? Also, the study as well showed us that the earlier the adversity, the more profound the impact of the adversity. So we're looking at over just under the age of 5, right? 33% of those 45% of people, this trauma or this adversity happened before 5 years old, right? Why might that be more profoundly impacted? Because our brains are still developing, right? And when we're doing all of that stuff that we saw earlier, in those formative years when our brains are still developing, you're creating that deleterious thing that I spoke about that tends to be harmful. And so I want to kind of put a frame around this. This was a landmark study that really kind of elevated our awareness and our attention to trauma, but there are some drawbacks here as well. One of the things is that the ACE study showed that, or the screen that they use, and some of you can find it online, the ACE screen tool, it only focused on abuse, neglect, and household dysfunction. That's what they measured. Whether there was some sort of abuse going on in the home, some neglectful circumstances, or some household or family dysfunction going on. Now, there's a whole realm of trauma. There's a whole realm of adversity outside of those 3 categories that were not even brought front and center, that were not even factored into the study, right? That particularly come into play when we're dealing with Black and brown people. Also, over 3/4 of the people in this study were white and were middle-class white. All right, and so that should tell us a little something about this study. This study brought us into a degree of awareness, but it wasn't the be all and the end all. There's so much more that we need to know and understand. And so when you take that and you cut this whole ACE, numbers across race, you begin to see a different picture, right? 40% of white people are said to have experienced some sort of ACE. But when you look at Black people as a unit, now that connects to 61%. That national average increases significantly for Black people. For Hispanic people, 51%, and it's much less for Asians, right? I would imagine, based upon what's going on in time, when this COVID thing happened, there was a spike for Asians, right? Because there was a lot of anti-Asian rhetoric and attacks and things that were going on. So that would have gone up there. But suffice it to say, the general average, the general tends to be extremely high elevations for Black and Latino. And so I want to just kind of look at some of those contributing factors specific to the Latinx community. There are some things that speak to why, and I would say the biggest factor, and this is again not exclusive, but one of the biggest factors is the undocumented status. People who are undocumented, there's this constant, persistent fear of being deported. I can recall reading a really heart-wrenching story about a young girl who, all of the things that she found dear and precious to her life, she would pack every day in her book bag and bring to school because she did not know whether or not she was going to have a home to come to, if ICE was going to come and just kind of change her life completely. And she wanted to have these things with her. Like, these are the things we don't even think about that are weighing on people, right? This undocumented status is also a pretty hefty barrier to help seeking, right? If I'm undocumented, I'm afraid that someone's going to find that out. And so I may need mental health support. I may need medical support, but I might not seek that because, somebody might ask me if I'm documented or undocumented, right? The being vulnerable to victimization. There's victimization that's happening within this community. And guess what? I don't go to the police because I'm undocumented. and I'm afraid that they're just going to take me away. I remember a story. This was going some years back in New Jersey, in what they call the Neck, is a really hustling, bustling area right near Penn Station in Newark, New Jersey. That's a lot of Portuguese, a lot of Hispanic, but also a lot of undocumented people. But there's a lot of businesses and restaurants, and it's always a lot of hustle and bustle in that area. And there was at one point a traffic stop that was set up, and it went out through the community that ICE, it wasn't ICE, but it went through the community that ICE was there, and they were snatching up people. Newark is a sanctuary city. So despite the fact that Newark is a sanctuary city, despite the fact that by law, the police, at least anywhere, are not going to come and take you away for being undocumented, that what was normally a really very, very busy area, a lot of business, completely almost shut down. A lot of business owners were like hurting deeply because they weren't getting any customers. Nobody was on the street. It really was like a ghost town for a little while before people began to feel comfortable enough to come out again. That's the level of fear that people live in with that undocumented status. Also, there's a burden on young people because, mom and dad may not have been born here. I'm born here, I speak English, and I have to actually be the mouthpiece for my parents and get involved in, things that are really beyond my, beyond what I really should be aware of, what I should be involved in. I have to kind of navigate things for my parents. That's a level of stress that the average child does not have to even think about or worry about, right? And also we have to consider that many people, especially who have just migrated here, there is pre-migration trauma. They're not coming here for no reason at all. They're coming because they're experiencing trauma where they were living, and then they come here, and on top of that trauma, they're experiencing more trauma of being marginalized in a society that says you don't belong here. So I just want us to sit with that, because as I understand, you're dealing with a lot of people, if not directly impacted by this type of phenomenon and more, right? That at least they're connected with folks who are. And that's stressful because mom and dad are afraid, or my uncle and auntie was taken away already, or whatever is going on, right? Something we need to think about. And in terms of anti-Black racial trauma, I want to highlight also, I understand you have a large population of Black students as well. There's a really profound impact that Black people experience because of the trauma that is, just embedded in part of the structures of living in this country. This comes from the work of Dr. Ken Hardy, who I think is phenomenal. He's actually added on to this, but I'm only going to stick to this, and I don't have time to do a whole lot more. I can't believe time's running so short. I'm so sorry. He talks about these 4 points of impact, and there's this internalized devaluation that results from the internalization of the messaging, the white supremacist ideology messaging that we absorb over time that says, you're inferior, and if you're not white, well, if you're not white, you're inferior, and white people are superior, right? This assaulted sense of self, which I refer to as a deep spirit injury that happens due to this constant barrage of assaults to a person's dignity as a human being, the internalized voicelessness, right? The point that you, after a period of time, you learn that your voice doesn't matter, that you don't have a voice, that no matter how much you speak, nobody's listening. You can tell me all you want to I can't breathe, right? You can say it as many times as you want, but I'm not really listening. So you internalize that your voice doesn't matter. And then the last one he talks about is rage, that he distinguishes from anger, because anger, he says, is a more present emotion, where rage is the accumulation, right? Accumulation of anger that was unaddressed, accumulation of anger that was unvoiced, right? That tends to come out more in an explosive manner, right? It is externalized and may look like Black on Black violence, right? But it's there because of the trauma. It might be internalized and end up looking like self-destructive behaviors, substance abuse, or just a general apathy. I really don't even care anymore. I can't win anyway. So I really don't care. Yeah. And so this is, I just want to kind of put, this is like the first principle, the idea that trauma is pervasive. It's everywhere. And because it's everywhere, and far more than what the numbers are holding, right? Because the numbers, especially with that ACE study, didn't even calculate in race as a factor. So it's even far more than those numbers that I put up there would even let us to believe. It's very pervasive, and because it's pervasive, we want to kind of, we want to just kind of to know about it. We want to operate under this principle. The second principle is to avert re-traumatization. You may not have been able to do anything about the pre-migration trauma. You may not have been able to do anything about the anti-Black messaging that you're constantly getting that gets internalized. But you can do something when you connect with that person to avoid exacerbating, reactivating, or re-traumatizing that very thing, right? I was in a workshop just the other day, and they were talking about like social emotional learning. And this was really directed as typically toward Black and brown young people. There was a program, and they were talking about the need to help these young people to develop the ability to like debate and discuss, which is important. And he gave us an example of one of the topics, of one of the questions that they'll use and let the clients argue, let the students argue either a point for that point and against that point. But the example that he used was something to the effect of slavery was, he said slavery was, basically in many countries throughout the world, that the South is not unique or doesn't stand alone in this. I had a very visceral reaction to that, because let my child come home and tell me that they're put in a group where they have to argue to validate the fact that slavery in the South was fine, because it really was not just unique to the South, that this was something that happened throughout the world, and therefore we should accept and understand that. I thought that was extraordinarily insensitive. And to a people that have gone through that racial trauma, remember what I talked about, the voicelessness, the devaluation, all of that, right? When you put that question and then the mindset that has to correlate with that question before me, you are actually exacerbating my trauma. I hope people can get that, right? And so you may not have done anything or been able to do anything to stop the initial hurt, but you can certainly do something to avert re-traumatizing. And so what we want to do is break this cycle of trauma. There's the initial trauma, there's the psychological impact, and what happens as a result of it. But where you come in is not exacerbating, which we often do is we punish, right? So when students come in and they act a certain way, or they don't conform to all of the expectations of what they should conform to, we punish them. We punish them by maybe we fail them. We punish them by marginalizing them. We punish them by maybe embarrassing them. We punish them in so many different ways. And that's the piece that we can avert. That's where we can avoid the re-traumatization. All right. And so that's the second principle. I have one more minute, and I don't know if we have a little leeway here, so I should be asking, do we have any leeway, or we have a hard stop?
On my part, I think we might have some leeway if our guests are willing to stay.
I just
if anybody has any objections.
I guess if people have to fall off, then I totally understand. But just two more very brief. I'm not even going to go through this, but suffice it to say that the third principle, putting people on the pathway to healing, right? So we don't want to just avert re-traumatizing them. We want to avert re-traumatizing them and then help them, help the healing process to be ignited, right? And that's not always sending someone to a counselor either. There's so many things that we can do that I was hoping we would be able to get into. But the point here is that a trauma-informed perspective or approach is an upstream approach. It asks us to look, what happened before this point, right? What got the person to this point? That's where a trauma-informed perspective should take us. And the final principle is the fact that a trauma-informed approach is a universal precaution. One of the things that tends to elude people is knowing that a trauma-informed approach, people often say, well, how do I know that, who's impacted or who's traumatized and who's not traumatized? You don't have to know. You use it as a universal precaution. You use it across the board with everybody, because guess what? The people who are not traumatized, who are using it with, which I want to see that person, you're not hurting them. You're helping them as well. So you don't have to pick and choose. This just becomes our new normal way of functioning and interacting with people. And so I'm not going to go through that activity. I really wanted to, in fact, I'm going to come out of this. I wanted to engage more with you on what you're seeing on the ground, but we don't have a whole lot of time. But one of the points that I want to kind of circle back to, we touched it, but I really want to emphasize it a little bit more, something that Barbara was saying early on about the vicarious trauma. And as we looked at all of those principles, a trauma-informed perspective is not just what you show and demonstrate to and for your students, but is what you show and demonstrate to and for yourselves, to and for your colleagues. And a trauma-informed environment is not one that only cares for your students, but a trauma-informed environment is going to say, how can we do this better to care for our professionals that work here, our professors, our administrators, and all the other people that are working? What do we need to know and realize? How is the pressures of the job impacting them? And how can we alleviate some of that? That's what a trauma-informed perspective does as well. Okay, and so with that, I just want to, I'm already 2 minutes over. There's so much more I want to say and share, but I don't know if there is a question or two or comment, and I just want to kind of turn it back over to you all.
Monique, thank you so very much for discussing this with us. It's nice to hear the validation for the work I had done over a long period of time. So it's validation that I'm not crazy for considering, trauma. And I'm like, people, this is trauma. And people look at me like I'm crazy. So thank you for addressing it and giving all of us this information. Does anybody have any questions for Monique that weren't addressed during the presentation?
Nancy?
Oh, no, I was just going to make a comment. During the time of COVID, I've had a student that has been a student for a while, and she has a diagnosis of schizophrenia. But what happened was during COVID, she's had multiple psychiatric hospitalizations. Mm-hmm. And so she got reached out to me. And so I was working with her through the process. And then she's also known to our office because she needs modifications for testing and that kind of stuff because of her anxiety. And I reached out, and so I was put in a position almost as if I should have reached out sooner, even though she was known to this office from the time that she enrolled in the school, because I was trying to get her services so that we could provide like more of a environmental support with all the Wi-Fi and all the additional things that she would need in order to be able to, and as a student, she actually does well. And then I had another student that also had a psychiatric break and had to be hospitalized because her mother became ill. Her mother was a single parent. My student was 19. And so I have a background in healthcare. And so, I know like the kind of structures that you need in order to support people. And so I was trying to get it done, because if we already have students that we're aware of that have these diagnoses, and they're aware to an office that is supposed to direct them to resources, I think that, we need to have all that done and in place before something like this happens and it gets progressively worse.
Yeah. I mean, so you're kind of highlighting for me the fact that being trauma informed is kind of how you and I show up in the world, but being trauma informed also really, really has to become a systemic process, right? We have to create a trauma informed system, and that's how we're going to, otherwise there'll be a lot of gaps that many people will fall into, like what you're talking about there.
Right.
So
Dr. Swift helped me in a way to advocate, because I come from a healthcare background. So I was new to academia when I was hired. And so I need, I know how to like advocate in the healthcare community for people that are disenfranchised. It was at the school setting where, the school is receiving money to be able to provide these resources. And so there's gaps and fragmentation in those resources. And so I want to know how to advocate. I'm feeling more comfortable now because I'm tenured than before in my advocacy role, but I want to be able to advocate adequately for the services. So the services show up that are, in writing that we have.
Right. And so you're talking about policy change, right? Thank you, Marcella, for being with us. And sorry that we peeked over here, but you're talking about policy change. And
thank you so much. Really, it's great. And I just want to wish everybody a good end of the semester. And again, thank you, Monique. This is always very helpful.
Awesome. Appreciate your input, and thank you. You have a great rest of your day.
Thank you, Marcella.
So, but Nancy, to your point, you're talking about policy change, and you're getting into what is now being known as, like, we've heard of cultural competence, but structural competence.
Right.
Structural competence is an approach that's kind of happening in the medical field, but it's something that we all need to, it can expand way beyond. It doesn't just apply to the medical field, but looking at everything from the individual level all the way to kind of policy, research, and everything in between, that at every stop point, there has to be some aspects, changes and systemic inputs that help to kind of allow that system, the integrity of the system, to reflect a trauma-informed a way of existing. As long as you have those gaps, as long as you leave out points, you're gonna lose people along the way. So the how, you can't do it by yourself, right? I'm glad to hear that you have the motivation and the spirit that you have to do it. You can and will make a difference. I know of situations, the whole thing that happened in Flint, Michigan, and all the publicity that ultimately happened started with one MD, one person who was outraged and decided to make noise because of what she was seeing that happened in that city. And now it's become a national outrage, right? But still hasn't, anyway, that's a whole nother thing, right?
So it's going to hit education larger. In California, on the elementary level, we've already had the Peter P. versus Compton case, which happened. Nancy, you were talking about advocating through ARC. That's the community that started it. They were looking at a way, how do we have change met? And they weren't providing a safe environment for education to happen. So it's going to come our way sooner
Right.
or later.
And now with the, now the big thing is DEI, right? Diversity, equity, and inclusion. And so now the federal government has passed a law where companies are going to have to audit, because all of this has to do with like who runs, who's in charge of all these infrastructures within these organizations. And if there is no diversity, then you can expect the administration to kind of be responsive to a lot of these things that we want to, like you have to have like some awareness so that you could have some kind of insight to develop things that are responsive. And so now that we're talking about that, Stacy and I both serve on the Affirmative Action Committee that most recently became the Affirmative Action, Diversity, Equity, and Inclusion Committee.
It's a long name.
One of the things that we have discussed there, and I don't know if we could engage Monique to return, is that we wanted to actually help promote to our annual, it's called the SPA Day, but what it really is a training day for the faculty to bring diversity, equity, and inclusion experts to kind of do a workshop or a talk where how is that going to look? And actually organizations will be audited now going forward by the federal government. And so this is about more than just having people of color. It's having people of color in positions of authority, having people of color, as chairs, having people of color in areas where they're going to have a presence that will truly then be representative of the diversity that we do have.
Yeah. And so, and to hopefully extend beyond that and kind of marry that to this whole idea of being trauma informed and racially trauma informed, right? Because you can't be trauma informed without the racial competence, understanding how that factors in. But what I have found, I don't know if you're finding this with the board that you sit on, but DEI tends to invite people to lean toward numbers, right? Well, we have this many Black people, this many Latinas, this many gay people, this many, right? As opposed to, but yet the numbers might be representative, but that's not the end point, right? What we want is that people are being kind of honored in the spirit of who they are in the spaces that they occupy. That's a whole nother level of things that I feel like DEI doesn't punch enough. I'm sure some people out there doing that. But I'm hoping that as you, Stacy and Nancy, are sitting at the table with your awareness and what you bring, that you are reminding people to keep that factored into the equation.
Right.
That's a good point. I think we have to be mindful.
We need recommendations, right?
Yeah.
We need recommendations and guidance to best inform that process.
Marie, no.
Yeah. So I know time is we're way over, and Nancy, thank you so much. And I guess Sue is also I guess she left us, but she hung in there.
We want to thank you. I think you make really good, important points. I think we have to be mindful about when we come to things like DEI, like tokenization of people in these spaces. I think, and I think, yes, these conversations, I think with faculty, and I don't know, Nancy and JC, one of the things I've realized as a faculty member is that the hierarchy of the system, you have these administrators, you have the faculty, you have, adjuncts, and I think that's one of the problems of academia. I'm sure that's probably systematic everywhere, but the conversations that are happening, and this is where lines of communication need to change a little bit, where the conversations happening at the administrative level doesn't really involve us per se, right? it involves administrators, they make decisions, and you come after and have to do the work that they've made decisions on, right? But yet still, and yet still you find yourself, having to do the work and then having to figure out big issues that are probably administrative issues rather than faculty issues. And so I think the voices of faculty are not always heard in a lot of these conversations that affect our lives. And I think that plays into, unfortunately, a traumatizing of faculty per se, right? Because you are now caught up in a system that is imposing things on you, but you're not contributing towards per se, right? And so, but yet still people act as if you're contributing. So there comes this tokenization of it, where they're trying to make it seem like we're doing this all together when you're not really, right? So you have this top-down approach, yet still people are expecting a lot of pressure is being put on faculty to actually clean things up. And people have been saying that for a long time. And I think it's part of the problematic nature of academia in itself, right? And I don't have nothing against administrators. I just think the structure that existed before me is problematic. And I could see that as someone entering from one space as an adjunct into a full-timer position. And I'm sure Nancy could see it coming from her administrative background, that there are some issues with the structure of our system. Is that going to change? I don't know. Can I change it as a faculty? Probably not,
Well,
but.
And I think that was Monique's actual, I'm sorry to interrupt, like the actual point of the talk is that the system has not been responsive, and they need to have an awareness that they haven't been responsive because it's been impacted by this history of racism, of making like certain people are not as smart, not as competent, and so their recommendations are not as valid. And so that has to change.
You're so right. To me, that's kind of another level of things, kind of getting people to understand the basic understanding of, being trauma informed, but the whole race piece. There's a talk that I do beyond the individual, where I really hone in on the critical importance of taking this question, this issue, this problem from an individual level and putting it on a systems level. If we don't look at it from a systems perspective, we're going to keep on missing. We're going to hit and miss on the individual level, but the systems will continue to crush people in the way that it's crushing people. So we have to elevate the conversation. You said it so well, Nancy. We have to elevate the conversation.
That's right. I think, and that's an important conversation in itself that needs to be had, where you have the people in the room who are going to ask these difficult questions. When we see something play out on an individual level in our work or in our job, that's not necessarily an individual problem. That's a system problem, right? I've been having a lot of conversations about anti-Blackness and all of these things recently, learning more about it from, things that you knew, but things that you can now enact. It's that, when you see what we call the crabs in the barrel kind of thing, right? I don't know if you guys know that metaphor, right?
Yes.
Crabs in the barrel isn't a one-on-one person thing. It's a system thing, right? And that's just one example. It's a system, it's a resource thing. It's a racialized system. I mean, we can't say that in America. We don't live in a racialized system. The more I live here, the longer I live here, the more I realize it's hitting me in the face every day. We live in a racialized system. And so we're positioned, right? And so we can't ignore it. And then, even if we, I would say at Hostos, even if we have predominantly minority people, it doesn't alleviate us from this racialized system. And it doesn't alleviate crabs in a barrel behavior and mentality.
That's why we
causes
can't get
trauma,
numbers.
Right? We can't be tokens in a system. And of course, some people are comfortable with being that. And of course, some people are like, let me do some real work, right?
Yeah.
But, it's like, you see these things playing out, and I know CUNY's big on this whole anti-bullying thing, but the bullying thing is part of this trauma and re-traumatization for people. They never mention it as part of that conversation. They just talk about it as bullying, as if bullying is its own thing. But the bullying we might be experiencing here in our school is a racialized bullying for the most part. It is a trauma bullying. It is a systematic thing. that you see people in offices who, you know, I mean, I don't want to put, you know, I go to meetings where people are constantly reminding you of their position. I've been this coordinator for 50 years. I've been that coordinator for 99 years. And I'm like, well, what is this about? Because this has nothing to do with me. I am not taking away your legitimacy by being in the room. I'm actually saying it's okay. I want to learn more about what happened 30, 40, 50 years ago. However, you're not talking about it from that perspective. You're talking about it as, well, I'm legitimate because I've been here for 30, 40, 50 years. And as if someone's trying to take away your power. And that's the crabs in the barrel mentality. And that's where the bullying can come from, because people are like, oh, you're not listening to me. And, you know, do what I say. There's a lot of that in our school. Do what I say. Don't have a voice. This voicelessness that we talk about that gets aggravated by, you know, not just positionality, right, by power structures, but racialized power structures, right? And so you have people who feel that they have the voice and they don't have to question it, right? And then you have people who are newcomers to the field that don't have a voice. I literally had this conversation with our department chair that I cannot raise issues in our unit meeting because of my position. And he could not understand. And this is, and they know him. So they're probably like, well, he would have said that. Yeah, he said that to me. But then think about who he is in a racialized structure and system, right? He's a white male. So he is not going to understand when I say that from the position of the racialized structure that we're within. He might understand if we're like, you know, a newcomer versus older people, but they're not separate issues. Newcomer, young, older people, race, gender, they're all working together. So people, when you enter in that room, and I'm like, I might have a useful point to say, but I'm not gonna say it until I get tenure. You notice Nancy said that when she said it, right? Until I get tenure. Then I might actually say something, right? But then by the time people get tenure, they might get burnt out because they're so traumatized. They don't want to do anything, right? Nancy's actually an advocate.
How even that is learned behavior in terms of your ability to survive in a place.
Right.
You know,
but that's part of an issue, right?
We become so attuned as women. We become so attuned as people of color. We're constantly having, this is why women are so survival, are so adaptable, that we, you know, we outlive men when the world is actually more hostile to us, because we're constantly adapting, like dodging to survive. And so in academia, it's not like we get overwhelmed, because our whole life has trained us to, okay, wait up. I know exactly when to be quiet, and I know when I'm allowed to have a voice.
So, I mean, but that adaptability
it's unfortunate.
Is good, but it's also tiring as well.
Of course, that's what I wanted to add. It fatigues you psychologically, physically, all of those areas that we spoke about. It fatigues you. And then ultimately, like you said, Stacey, you can kind of lapse into an apathy. Like I feel defeated. I feel helpless. I feel hopeless.
That's what I so appreciate about Nancy. She never gives up. She's always talking about something, advocacy wise. I know if I see Nancy's name on a poster flyer, it's safe to send my students to that event. I've never said that to her before, but I know it's safe to send my students because my Latina students need mentorship too.
Can I tell you, isn't that something I feel like that about you and about Stacey? Like when I see Stacey with students, like my heart glows, because I know that they're really like growing. You understand? They're not gonna come away from her like feeling terrible about themselves. And so, you know, like I see the dynamics of students with different faculty. And so it's so true. Even in that, we've learned like how to navigate our students to keep them safe.
Isn't that something? Isn't that something? Like, that's amazing. And I'm sorry, but I do have a 1 o'clock.
Oh, yeah.
But thank you, Dr. Swift. Thank you, Dr. Swift. We appreciate it.
Come back, Monique.
We're going to extend the invitation right now to join us for other events. you have an open invitation.
I appreciate that. And thank you again,
that's the
JC,
thing.
for connecting me to these amazing
My
people.
pleasure. Thank you. Thank
Thank
you. I
you.
knew you already walked the talk. So I said, oh, she's perfect for this. If she, you know, and we worked around your schedule because
Yes,
I
we
just
appreciate
knew
you taking the time.
we
And
really
by the way, fabulous
appreciate-
glasses.
Oh, thank you. Thank you. Thank you. I appreciate you all, and keep doing the amazing work that you're doing. Clearly you are those people, the vanguards out front and trying to save the rest of us. So thank you.
All right, my love. We'll talk soon.